What if everything you thought was helping you was actually making you worse? We've all heard about the placebo effect, how belief in a treatment can make you feel better. But what about the flip side? The nocebo effect, where negative expectations can cause real harm, is as fascinating as it is unsettling. And why do we know so little about it compared to the placebo? And could you be more vulnerable to the nocebo effect than you realize? Okay, so we've all heard of the placebo effect, right? That's when you feel better because you believe a treatment will work, even if it's a simple sugar pill. Well, the nocebo effect is placebo's sinister twin. Nocebo is Latin for "I shall cause harm," and it's when you start feeling side effects, not because of the treatment, but because you're convinced it's going to make you feel awful. In other words, your brain goes, "Oh, you're expecting problems? Let's make them real." It's like your mind is playing pranks, but these effects can have real consequences, turning mere expectations into reality. And despite the nocebo being a well-documented phenomenon in medicine, it's surprisingly rare to see it tested in clinical trials. Why? Because ethically, it's a bit of a minefield. To deliberately cause pain or discomfort even for research purposes isn't exactly something you'd want to do in healthcare. Now, let's dive into some real-life examples of the nocebo effect. First, here's one that might hit a little closer to home. Imagine you're taking medication for a condition called Disease X, and things seem fine. Then, while scrolling through your news feed, you find a complaint about headaches from the very same medication you're taking. A few days later, guess what? You're rubbing your temples too. Coincidence? Maybe. Or perhaps it's the nocebo effect in action, sneakily convincing your body to play copycat. This isn't just a random scenario. Back in 2013, a media storm about statins, a drug used to lower cholesterol, led to a massive public health scare. Stories of muscle pain caused 200,000 patients to stop taking their medication within 6 months. Reports of a rare but serious muscle injury, rhabdomyolysis, also spiked. But the truth? Many of these reactions were fueled more by fear than fact. And the nocebo effect doesn't just affect everyday people. It's a huge issue in clinical trials too. Studies reveal that up to 65% of participants in trials for Parkinson's disease report experiencing side effects from placebos, and about 1 in 10 drops out entirely due to these imagined side effects. While some symptoms are subjective, like nausea or fatigue, others are measurable. For instance, patients have reported rashes and elevated liver enzyme levels when taking sugar pills, all triggered by their minds, not the medication. And then, there are the extreme cases. Take Sam Schumann, for example. Back in the 1970s, he was delivered devastating news. A liver scan suggested his cancer had spread aggressively, and was told he had only a few months to live. And sure enough, he passed away a few months later as predicted by his doctor. But Sam didn't have terminal cancer. His autopsy revealed only a small, harmless tumor. Despite his inaccurate diagnosis, his belief in it was so powerful that it became a self-fulfilling prophecy. So, whether it's something small or truly extraordinary, these examples reveal just how powerful our expectations and beliefs can be. It's a mind-blowing concept that makes us rethink how we approach illness, medicine, and the power our minds have over our body. So, how exactly does the nocebo effect work in your brain and body? To understand this, let's take a closer look at how your brain communicates with your body. When you're anxious about pain, such as hearing that a treatment might cause discomfort, the brain activates a region called the periaqueductal gray matter. Anxiety triggers the release of a molecule called cholecystokinin, which is involved in transmitting pain signals, causing the body to be more sensitive to pain. But that's not all. The hypothalamic pituitary adrenal axis can also become overactive when you're expecting something bad. It releases stress hormones like cortisol, causing heightened feelings of discomfort and anxiety. However, on the flip side, when you expect something positive, such as believing a treatment will ease your pain, the brain activates a different pathway. Endogenous opioids, the body's natural painkillers, are released, helping reduce pain and creating a sense of relief. Now, while this explanation covers the basics of how the nocebo effect works, this is still a relatively new area of research, and scientists are continuing to explore how exactly the mind and body interact in this way. But since everyone is so different, who is most at risk? Individuals with certain psychological predispositions are more likely to experience nocebo effects. Those who deal with anxiety, depression, or have a tendency to focus on physical symptoms are particularly vulnerable. On top of that, if someone's had a negative experience with a medication before, they may be more likely to link new symptoms to side effects, even if the drug itself is harmless. Your personality might also play a part. For example, people with a type A personality, those who are competitive, driven, and always on the go are more likely to experience nocebo effects. They tend to lead more stressful lives, and their high-energy mindset might make them more focused on potential side effects, as opposed to type B personalities, who are typically more relaxed and less likely to report negative effects from a placebo. And let's not forget your environment. Sometimes, even subtle cues from your healthcare provider, like a concerned tone, a raised eyebrow, or a slight frown, can unintentionally trigger a nocebo response. And while doctors and nurses might unknowingly contribute to the nocebo effect, patients themselves can also play a role. Whether it's searching the internet, reading patient forums, or looking over medication leaflets, people who tend to expect the worst might actively seek out reasons to worry about side effects. So, what does all of this tell us about the nocebo effect? It's clear that the mind and body are deeply interconnected, and our expectations, whether positive or negative, can have a profound impact on our physical health. Now, this doesn't mean you should never worry. Worrying is a normal part of life, but balance and awareness are key. By understanding how our beliefs and expectations shape our health, we can better manage the power of our thoughts. Thanks for watching. If you found this video insightful, don't forget to like, subscribe, and hit the bell for more fascinating discussions about science. Until next time, take care of your body and your mind.